Hi friends, hello everyone. In this video, we are going to focus on the osteology of hip bone. I have made one more model of hip bone for the understanding of osteology of hip bone in a better way. The hip bone is a large irregular bone. It contains three parts, that is ilium, pubis, ischium. Ilium is the upper part of the hip bone and pubis is the inferior anterior part of the hip bone and ischium is the posterior inferior part of the hip bone. And the junction of these three bones will have a cup-shaped depression called acetabulum. This acetabulum is contributed in a different manner from all the three bones. Now let's see the parts one by one. Let's see first ilium. Ilium is a flattened bone in the hip bone and the upper end of the ilium is iliac crest and the lower end of the ilium will fuses with the pubis and ischium to form the acetabulum also. And the ilium has three borders. First border, that is anterior border, is this one, and the second border is posterior border is this one, and the medial border is from the iliac crest, in the middle of the iliac crest to the fusion of ilium and pubis. It extends from iliac crest to the junction of ilium and pubis. These three borders will separate the ilium into three surfaces. The first surface is iliac fossa. It is between the anterior border and the medial border. And the second surface is sacropelvic surface, is this one. This is between the medial border and the posterior border. And the third surface is the lateral surface. It is gluteal surface. It lies between the anterior border and the posterior border. Let's now focus on the iliac crest. The iliac crest is a convex ridge when you look from the upside, and this iliac crest is divided into two parts, that is anterior 2/3 from here to here, anterior 2/3, and the posterior 1/3 part. The anterior 2/3 part will have an inner lip and an outer lip and between intermediate zone, but the posterior 1/3 will have only two slopes. It won't have any lips or any ridges, only a medial slope and a lateral slope, but it will have a flat intermediate zone in its anterior 2/3 part. The highest point of the iliac crest will lie in our body in the level between the spine of L3 and L4. This is the highest point of the iliac crest. And the anterior end of the iliac crest is called anterior superior iliac spine. This one is the anterior superior iliac spine. And the posterior end of this iliac crest, this one, it is a posterior superior iliac spine. Now let's see the borders in detail. In the anterior border, it runs from the anterior superior iliac spine to the acetabulum. In the middle of this anterior border, it will have one more elevation called anterior inferior iliac spine. This one is anterior superior iliac spine, and this one is anterior inferior iliac spine. And same as this, in the posterior border, when it runs from the iliac crest to the starting of the ischium, it will have one more elevation here. This elevation is posterior inferior iliac spine. It lies below the posterior superior iliac spine. And the medial border will run from the iliac crest to the iliopubic eminence. Iliopubic eminence is nothing but the junction of ilium to the pubis, this one. This area is called as iliopubic eminence. And the upper part of this medial border will separate the iliac fossa from the sacropelvic surface, but the lower part of the medial border will form the iliac part of the inlet of the pelvis. this will form the iliac part for the inlet of the pelvis. In addition to this hip bone, if we keep one more hip bone in the opposite side along with the sacrum and coccyx behind, it will form the pelvic girdle of our body. In this pelvic girdle, you can see this pelvic girdle in the picture beside, and in this pelvic girdle, if you see this ilium part and this ilium part will cover a surface upper. This upper surface is false pelvis. If you notice, this will form a border. It will continue to the next hip bone like this. This border will form the inlet for the true pelvis. The area covered below this border is called the true pelvis of the pelvic girdle. And now let's see the surfaces in detail. First, the iliac fossa. It is a concave flattened surface which is a smooth surface, gives attachment for the iliacus muscle. And next, the sacropelvic surface. This sacropelvic surface is separated into three parts. The first one is iliac tuberosity. This roughened surface is iliac tuberosity, and this smooth surface is auricular facet. This auricular facet will articulate with the sacrum bone and form sacroiliac joint. And this small area below the auricular facet is pelvic surface, because it will form the true pelvic surface in the lateral side. And next surface is gluteal surface. In the gluteal surface, this gluteal surface is convex in the lateral side, and this surface is separated into four parts by a three gluteal line. The three gluteal lines are posterior gluteal line, anterior gluteal line, and inferior gluteal line. The posterior gluteal line will start from the posterior side of the iliac crest, just 4 cm before the posterior superior iliac spine, and it runs up to the upper border of the greater sciatic notch. This one is the greater sciatic notch. This greater sciatic notch is formed by the posterior border of the ilium. And the anterior gluteal line. This anterior gluteal line starts just 5 cm behind the anterior superior iliac spine in the iliac crest, and it runs up to the apex of the greater sciatic notch. And the next gluteal line is inferior gluteal line. This inferior gluteal line starts between the anterior superior iliac spine and anterior inferior iliac spine, and it runs towards the greater sciatic notch. These three gluteal lines will separate the gluteal surface into 4 surfaces. After I drew these lines in the iliac crest, you can notice the two lips, that's the inner lip and outer lip. You can notice these two lips clearly, and in the outer lip there will be a tubercle here. Now let's see the next part, that is pubis. It lies in the inferior and the anterior part of the hip bone. The pubis is made up of a body and 2 ramuses. That one is superior ramus and the inferior ramus. The body is a flattened one, and it has 3 surfaces, that is anterior surface, posterior surface, and the medial surface. The anterior surface is facing downwards and slightly lateral, and the posterior surface will face upwards and slightly medial, and the medial surface will have symphyseal surface. This symphyseal surface will articulate with the opposite hip bone to form the pubic symphysis joint. It is a cartilaginous joint formed by the 2 pubis of the hip bone. And next, the upper part of the body will have a pubic crest. it's not clearly visible in this model. You can see in this picture the iliac crest is a small elevation in the body of the pubis. The lateral end of the iliac crest will have a tubercle. This tubercle is called as pubic tubercle. You can see the inlet of the pelvis clearly in this picture. The medial border I have mentioned in the ilium is arcuate line of the inlet of pelvis, and the inlet of pelvis is formed by the ala of the sacrum and the arcuate line of the ilium and pectine pubis of the superior ramus of the pubis and the pubic crest of the body of the pubis. These four margins will join to form the inlet of the true pelvis. Now let's see the superior ramus in detail. The superior ramus extends from the body of the pubis to the acetabulum, and the superior ramus have three borders. The first border is superior border, and second border is inferior border, and third border is anterior border. The superior border will extend from the tubercle, that is pubic tubercle, to the posterior part of the iliopubic eminence. The junction of the ilium and pubis is called iliopubic eminence, and this superior border is also called pectine pubis. The anterior border will extend from the pubic tubercle to the acetabulum. This anterior border is also called obturator crest, and the inferior border is just extend from the body of the pubis same to the posterior side of the acetabulum. This inferior border will form the superior border for the obturator foramen. That means the inferior border of the superior ramus of pubis will form the superior border of obturator foramen. This foramen is called obturator foramen. It is covered by the pubis and ischium. Now, these three borders of the superior ramus separating three surfaces in the superior ramus. The first surface is pectineal surface. The pectineal surface lies between the anterior border and the superior border. This surface is triangular in shape, and the second surface is pelvic surface. This pelvic surface is between the superior border and inferior border of the superior ramus. This pelvic surface of ramus will form the anterior surface of the pelvis, and the next surface is between the anterior border and the inferior border. It's below the superior ramus. This surface is called obturator surface, and this surface will have a groove called obturator groove. Now let's see the ischium. Ischium is the posterior inferior part of the hip bone. It has a body and a ramus. The body is a massive part which joined with the acetabulum, and the body have two ends. The upper end is articulate with the acetabulum and the ilium, and the lower end will form the ischial tuberosity. This one is the lower end of the body. This is the body, and this is the lower end of the body. This lower end will continue as the ramus, and this ramus will join with the inferior ramus of the pubis. Now this ischium has three borders. These three borders are, first one is anterior border. The anterior border is this one. This is the anterior border of the ischium, and the lateral border. It's start from the acetabulum and form the lateral margin of the ischial tuberosity and extends down. And the posterior border. The posterior border is this. The posterior border is continuation of the posterior border of the ilium, and it will end up in the upper part of the ischial tuberosity. This posterior border will form the lower border of the greater sciatic notch, and it will completely form the border of the lesser sciatic notch here. And these three borders will separate the ischium into three surfaces. The anterior border and the lateral border will separate a surface called femoral surface. This one is the femoral surface because this surface facing the femur. You know that the acetabulum will articulate with the head of the femur here, and the femur will come in this direction here. This surface is facing the femur, so they name it as femoral surface. And the surface separated by the anterior border and the posterior border of the ischium is called the pelvic surface because it facing the pelvis. The pelvic surface is a smooth surface and form the lateral wall of the pelvis, and the surface separated by the lateral border and the posterior border is called dorsal surface. This one starts from here, this goes down up till the end of the ramus. This one is the dorsal surface of the ischium. The dorsal surface is a convex surface. The junction of this inferior ramus of pubis and the ramus of ischium is called ischiopubic ramus. Now let's focus on the acetabulum. The acetabulum is an hemispherical cavity in the lateral aspect of the hip bone. The acetabulum is present in the lateral side of the hip bone, and the acetabulum is directed laterally downwards and slightly forward in our body. And the margin of the acetabulum is deficient in the lower end. This notch is called acetabular notch, and it is bridged by the transverse ligament in our body. The non-articular roughened floor, that is this part does not articulate with the head of the femur, and it will contain a mass of fat which is covered by the synovial membrane over here. And this area is called acetabular fossa. The horseshoe-shaped surface which is articulate with the head of femur is called lunate surface. This surface is lined by the hyaline cartilage when it articulates with the head of the femur and form the hip joint. The fibrocartilaginous acetabular labrum is attached to the margin of this acetabulum to make this acetabular cavity more deeper, and this deepened cavity will make the hip joint more stable. The stability is inversely proportional to the mobility of a joint. If a joint is more stable by its bone shape, then the mobility of the joint will decrease. If we compare the hip joint with our shoulder joint is freely movable than the hip joint due to its structure of the joint, because in the shoulder joint the glenate cavity is more shallow than the acetabulum in the hip bone. Now let's focus on the obturator foramen. The obturator foramen is a large gap in the hip bone which is present between the pubis and the ischium, and this foramen is large and oval in males, and it is small and triangular in the females, and it is closed by an obturator membrane in our body which is attached to the margin of this obturator foramen, except in the obturator groove, that is here. Through this gap the vessels and nerves are passed out from the pelvis. Now let's see the side determination of the hip bone. First we want to fix which end is superior and which end is inferior. The superior is the iliac part and the inferior is pubic and ischial part. The second one is we have to point which one is medial and which one is lateral. The medial is the iliac fossa surface, which is a smooth surface, and the lateral part will have an acetabulum. This is the lateral part. So we fixed 2 points, superior, inferior and medial, lateral. Now we want to see which one is anterior and posterior. The anterior part will have the pubis and the posterior part will have the ischium. Or you can say the anterior will have the superior anterior iliac spine and the posterior will have the superior posterior iliac spine. These are the points which you can use to determine the side of the hip bone. This bone belongs to the right of the hip, and there is a point called anatomical position. Anatomical position is position of the bone in our body. Anatomical position, the anterior superior iliac spine and the pubic symphysis should lie in the same coronal plane like this. It should be in the same plane, and the pubic symphysis should lie in the median plane of our body. In this position, the pelvic surface, that is the posterior surface of the body of pubis, will face slightly superior and backward. We covered the concept related to hip bone. Thanks for watching and continue to watch. I will continue to post the videos on the lower limb and the muscles attachment to the hip bone and the femur in the next video.